ACCC came over to City of Hope and did an interview of all the different geriatric oncology disciplines, because the City of Hope is finished a study, but at the time they were doing a study where we went ahead and did a comprehensive geriatric assessment for outpatients who were starting new chemotherapy treatments. And so they came to talk to the multidisciplinary group that was involved and interviewed the various disciplines: PT, nutrition, pharmacy, and nursing. And we have 2 nurse practitioners that are specializing in geriatric nurse practitioners, and they're the ones who are actually doing the geriatric assessment with the patients, doing the necessary referrals to the various disciplines so that the patient is optimized in getting the treatment and completing the treatment. They published a piece in their magazine, and they also talked a lot about Dr. Hurria's work in general. And they presented a case study. Okay, I think it was 2 patients where they kind of outlined what the patient came in with, what were the interventions that were provided with this particular model of care, where we had a multidisciplinary group discuss the patient and then provide the necessary interventions. One of the things that we like to say is that it takes a village to take care of older adults, because you need various disciplines involved in looking at the patient as a whole. So a more holistic approach to the patient and making sure that all the disciplines are at the table to discuss and make sure that we're providing the right interventions and not missing anything for the patient, to have their treatment and provide all the interventions that are needed. And that could be, if they've fallen or have gait imbalance, that we recommend referral to physical therapy or occupational therapy so that the patient doesn't get worse, or at least maintains their functional level. So I'm the project director for the R25. The program is called Educating Nurses to Improve Quality Care. And basically, Dr. Hurria solicited this grant. There's 2 other co-PIs on there, and that's Denise Economo and Peggy Burhan. And basically what this grant wanted to do is educate nurses in geriatric oncology. And we recruited over 400 nurses to come to this conference, and it was 100 nurses a year. And when they came with some goals that they wanted to implement in their institutions. And so that was the goal, to kind of spread the word about geriatric oncology and then actually put it into practice. So a lot of these teams went back to their institutions to implement their goals, and we are following up with them. So we just had the one last cohort that attended in February. We had just under 90 participants that came. But we're going to be following up with them at 6, 12, and 18 months. And we're in the process of writing up all the various phases of the grant, the development of the grant, the curriculum, what nurses gained as far as knowledge, and we'll be looking at the goals that were implemented to see, what effect it's had on practice for nurses and in their institutions.